frozen shoulder or adhesive capsulitis. That's what we're talking about today.
Treatment is easy. Put on a jacket, move to a warmer climate. Thanks for watching.
That is not the treatment. Welcome to Talking with Docs. I'm Dr. Brad Weening.
And I'm Dr. Paul Zalzal.
We have a guest, Dr. John Haverstock, upper extremity surgeon, going to talk to us all about the frozen shoulder, which is a very debilitating problem and not, surprisingly, not that uncommon.
Oh yeah.
Okay, so let's start at the beginning, John. What is it?
So frozen shoulder, the scientific name is adhesive capsulitis, is when the lining of the joint, so all joints have a capsule. And I explained that in the shoulder, it's very much like a silk lining. It's thin, it's supple, it's even low friction. But for some reason, our body decides to change that layer, that capsule, and it makes it very thick. So rather than being thin like a layer of silk, it's thick now like rawhide and leather. And it's something that our body does either in response to injury or more commonly, it just happens out of the blue.
No one's buying the rawhide pajamas, that's for sure. Okay, so most often after trauma, or most often out of the blue, which would you say?
More often for no reason.
Just spontaneously. Middle age usually?
Middle age, more commonly in females for some reason.
Okay. And how do people present? Like, what does it look like when someone has frozen shoulder?
Yeah, it starts with pain, pain for no reason, and it's usually felt from the top down the arm. This is where we feel much of our shoulder pain, and people notice that, hey, all of a sudden they can't, wash their hair, or they can't reach the seat belt. They have trouble getting dressed, and the pain can be quite pronounced at the start. And then stiffness becomes more of a problem over the subsequent weeks.
So instead of taking a shower, they're reaching for the dry shampoo.
Perfume or cologne.
There you go.
Okay, so you think you might have frozen shoulder. You're going to go see your doctor. The doctor's going to do a history and ask you just those things. I have trouble reaching behind you, trouble reaching the top of your head, and a physical examination. What are we going to find on physical examination?
So you're going to find limited motion. It's usually with your elbow at your side, everyone can kind of, I'm going to step back here. Usually everyone can reach a different amount, okay, with your elbow tucked at the side. And so if it's different on one side than another, then you've either got frozen shoulder or you've got arthritis. Okay. And a simple x-ray can sort that out. It's also going to be limited in terms of forward reach and getting behind your back. All of these things will be limited with frozen shoulder.
But external rotation is one of the big ones.
It's the earlier one, I think, yeah.
Okay.
Okay, so you've had a history, a physical examination, and you're going to be sent off for x-rays. And can you see frozen shoulder on x-rays, or are you seeing other stuff that you're ruling out on x-rays?
Yeah, you're ruling out the arthritis because sometimes people are treated for months on end for frozen shoulder when it's really arthritis, and that can be painful for them. But you can't see this on an x-ray, you can't see it on an ultrasound. You can maybe see it on an MRI if you really know what you're looking for.
Okay.
Okay, and sometimes can you see calcium deposits in the capsule? Is that a sort of late sign of an adhesive calcium?
That's more of a calcific tendonitis. I guess It's possible. It can, anything painful can start the frozen shoulder process, but normally we just see a normal x-ray.
Okay, so you've had your x-ray, it looks normal, so you've been given a diagnosis of frozen shoulder or adhesive capsulitis. Is that it? That's it? It's frozen for life, thanks for nothing? Or are there some treatment options available?
There are a lot of options, and unfortunately none of those options work perfectly. That's why we have a lot of options. We're trying to figure out what's going to work for you. And so number one is to get in to see a physiotherapist and start some stretching. Physiotherapy can certainly help with the pains associated with it, but they can't fix it in 4 or 5 sessions.
You just told me I got a sore shoulder. Now you're telling me I got to move my sore shoulder?
Yeah.
Okay.
It's physiotherapy is helpful. It's not going to cure it. Some people like that. Sometimes it's heat. Sometimes it's stretching the joints around the neck, working on your posture, loosening things up. That's what physiotherapy can do for you.
Or physical therapy for some of you. What about time? Is just waiting it out going to help the solution in any way?
For most people, the body will heal itself. Just like it brought this on insidiously, it will carry it away. But that can take 12 to 18 months commonly. Wow. And it will progress. It will improve throughout that window. Your symptoms will be different. It won't be so painful, but it takes a really long time. And sometimes that's the only sure thing.
Okay, so we've got time, we've got some sort of physio or physical therapy. Anything else?
Injections.
Yes.
So cortisone injections. perhaps in the shoulder, in the joint, is more effective than outside the joint.
Okay.
And sometimes those injections can kind of pressurize some saline, to stretch that tight lining, and that is called hydrodilation. And sometimes they can even kind of try to burst a small part of that capsule in a predictable, safe way, and that can improve motion.
Almost like a balloon, like you're trying to stretch out a balloon.
Exactly.
Okay.
I have a patient I was injecting a few times, and he was a busy person, couldn't often come in. So he said, "Can you just teach me how to inject it myself?" I said, "No."
Oh my. What about medications? Are there any role for like over-the-counter medications or potential prescription medications?
So taking acetaminophen, an anti-inflammatory, these things are designed to help with the pain. They work better together than in isolation. And so they're not going to change, I don't think, the history, unless, say, maybe you get on things really quickly.
Right.
You get your diagnosis quickly, you start your physical therapy quickly. Maybe those people are going to progress in a more prompt fashion, but it's hard to say.
And everybody knows in our healthcare system, everything happens very quickly.
Yeah. Question. So you did the hydrotherapy or dilating. Is there any role for surgery for this type of problem? So say I've had it 18 months, I'm 50 years old, I'm right-handed and I work hard. I can't do my job. Is there anything that you can do surgically?
Yeah. So back in the day, and we still do manipulations. So manipulation means, having a general anesthetic and then carefully kind of stretching the capsule. In effect, we're kind of tearing it. And so there's a small risk of breaking or fracturing a bone, but that is a possibility, and we can often improve your motion in the operating room. But when you wake up, it's going to be sore, and you're going to feel like maybe there wasn't much of an improvement. So you need to get right into the physical therapy.
Okay.
So a manipulation is maybe a simpler treatment, which comes with some of those risks, and then arthroscopy. So looking in the joint with the camera, we can actually release that tight tissue very carefully and then do a manipulation. So that's my preferred treatment, but it's kind of tricky, and we usually wait until someone has had it for about 18 months and is really debilitated despite other treatments.
Wow, not exactly a great news video. What percentage of people would you say, if you took all the people that show up in your office with frozen shoulder, say 3 years later, what percentage are still going to have it, or what percentage are going to be better?
Oh, the vast majority are going to be better.
Okay, that's good news.
Yeah, so it's perhaps maybe less than 5% would still be having problems. It's quite uncommon to have problems, and there's a lot of people that are being fully treated by their family physician and their physiotherapist, and they're getting better.
Okay, so I had frozen shoulder, it got better, thankfully, without major intervention, maybe some injections. Is there a high chance of it happening again or happening to the other shoulder?
It can happen on the other shoulder. I've never seen it happen on the same shoulder again.
Oh, well, there you go.
But in maybe 20% of people, it can happen on the other side. It's more likely to happen if you have diabetes that is not well controlled, or hypothyroidism that is not well controlled. There's some of these metabolic diseases that we think have a correlation.
What about preceding trauma, some sort of minor injury, something that stopped you from using your shoulder? Does that predispose you to it?
A lot of people come in and they're concerned about not developing a frozen shoulder. And I think more often people get stiffness after injury, but it's not the same as the frozen shoulder.
Right, so all stiff shoulders are not frozen shoulders. Because that term is thrown around a lot. Especially by
Absolutely,
patients.
yeah.
Okay.
If it's been going on for a while, make sure you have an x-ray, because there is a group of people that will have arthritis or something else going on, maybe calcific tendonitis, and the treatments can be different.
Riddle me that, but all frozen shoulders are stiff.
Yes.
There you go.
Now you know. So don't despair. If you have what's called a frozen shoulder, it's a very difficult time for sure. It's likely going to pass. You just have to hang in there and do whatever you can to control the symptoms.
And if you've had one and you've had an experience with this, some kind of intervention, leave a comment so that others who have this condition might be reassured by your story.
And if you like this video, please like it, subscribe to our channel.
Dr. Haverstock, thanks again for your expertise. And remember, you are in charge of your own health.
We'll see you next time.